We thought it'd be a good idea to have a press conference just so that we could let you all know what we know, calm any concerns the public might have, and just provide some basic information about this illness. So what we have is a confirmed case and a presumptive case of a disease called Neisseria meningitis. It commonly produces bacterial meningitis. It's rare. It's not highly transmissible, but it's serious. So we do have these two cases, and they involve two schools. One is Hedrick Middle School, and the other is Hoover Elementary School. We've worked very closely with the school district. We've worked closely with Oregon Health Authority, and we have identified those individuals that have had close contact both in the schools and in the family. We have provided prophylactic antibiotics, and I think that that process is pretty much finished. I think what the public needs to know is that, in fact, although this is a rare and serious illness, many of us carry the bacteria in our noses and throats on a regular basis. And in certain circumstances, individuals get sick from it. So when we provide prophylactic treatment, we're reducing the general incidence of the bacteria, but it doesn't go away. So that means that if you have been in contact with somebody who might have this disease, or your child has had contact and your child comes home, there is very little risk of this disease being spread in that fashion. So the public is safe, and we are using extra caution to reduce the incidence for those who had direct, intimate contact with the cases. Okay. There's a vaccine for this that is recommended for children 11 years and older and individuals going off to college. It's an interesting feature of this vaccine that, for whatever reason, in the state of Oregon, almost half of the cases are not responsive to the strains that are in the vaccine. We do not yet know what strain this is. We see no connection with this incidence and what occurred at Oregon State University and what occurred at University of Oregon earlier in the year. Maybe at this point I could take some questions, make sure that we've covered the things that you think are of concern to the public.
Which school is the confirmed case versus the one that's suspected?
Yeah, so the confirmed case is at Hedrick Middle School, and the presumptive case, which is a sibling, is at Hoover Elementary School.
How does this typically spread? I mean, you said that it seems like a low risk for when
right.
the kids come home and everything because of the fact that we all carry this, but how is this actually spread?
It's spread by droplets, the same way that many upper respiratory infections are spread. So if somebody coughs or sneezes on you, you can get the bacteria transmitted to you, and that increases your risk of getting it. But certainly it's nothing like influenza where, if you get coughed on and you're susceptible, you're likely to get it. This is in a whole different category of infectiousness.
Because it has to be in the bloodstream.
It's just the nature of the disease. What they think happens is that many of us carry it, are not sick, and then you get another illness that kind of weakens your immune system, maybe makes your mucous membranes a little more inflamed and susceptible, and then you might get bacterial meningitis. But sort of like has to be the perfect storm for you to actually get sick with it.
Has school been canceled at any of these
No.
schools? Or
No.
Would you think about that as something to do?
No. This isn't the kind of disease that would call for that. Things could change. We could find other cases. We have not. This is not an outbreak. At the moment, we see no indication for that.
Any risk that this could be spreading to other districts? We know that there are some, obviously, other districts in our area that have a little bit lower vaccination rates. Any risk that it could be spreading to other places, or?
Whenever a community sees bacterial meningitis like this, it does increase the likelihood, that this strain, this bacteria, is a little more prevalent in the community. I think the wise thing for us to do is to have a little extra vigilance. So we sent out a release to the emergency rooms and healthcare providers around the community saying, keep your eyes open, pay a little more attention. And I think the public in general, a lot of people get sick this time of year, but if somebody's seriously ill, fever, vomiting, headache, neck stiffness, perhaps be a little more, a little quicker to get that checked out because those are the symptoms of bacterial meningitis.
Could you explain the situation with the vaccinations, the vaccines, the ones that are good, the ones that are not, the information that we got?
Yeah, right. So we have a vaccine, and it is effective against a number of the subspecies, the strains of Neisseria. It's been an unusual occurrence in Oregon for the last couple of decades that we have a little over half of our cases of meningitis are in Group B, which is not in the vaccine. So the vaccine is excellent in protecting you against the strains that it's developed for. But sometimes in Oregon we find that we have evidence of a different strain. We do not know the strain of this current case.
Do we know how the health of the student is who does have that illness at this point, who does have this?
I probably don't want to comment on that. I'd like to let you all know what we know without in any way identifying the cases. So,
under treatment, I would imagine.
Yes. Under treatment, in general, doing well, but I don't want to say any more than that.
Okay. And then those who might have been exposed to this as a result of the disease being identified, how many potential people do you think might have been exposed that you're looking at giving antibiotics to?
Off the top of my head, I think total maybe 75 people that we felt were close contacts that deserved the extra protection of prophylaxis.
All at Hedrick?
Oh, no. Hedrick, Hoover, and family members.
Any indication on when we might know if the second case is confirmed or not confirmed?
I'm going to guess the second case will probably remain presumptive. I think what we're going to end up at the end of the day is a confirmed case and a presumptive case.
Were the two students in each school, were they connected in any way?
They're siblings.
Oh, okay.
Yeah, and that's the reason that we're really considering this like one case, because we do know that that kind of close intimate contact does greatly increase the likelihood of transmission, and even then it's probably less than 1%. Just to give you an idea of kind of how infrequent this is.
We have someone on Facebook asking, how do they screen for this? How do they test it?
Screening would not really be the right terminology. This is a serious illness and it occurs very quickly. So if somebody presents with the symptoms of bacterial meningitis, then you would look at the clinical picture, you'd draw blood, you'd perhaps do a cerebral spinal fluid analysis, and you would immediately start treatment. So it's not a casual thing. It's usually kind of all or nothing.
And just to confirm, so 75 people about have been given a vaccine?
I think that's probably a ballpark number. Yeah. Anything else? Yeah.
Someone's asking, was the child immunized?
No. One of the children was too young, and the other just wasn't immunized. Anybody from the back of the room have anything that they think ought to be mentioned that wasn't mentioned?
So with the vaccine, it's not a school-required immunization, it's just highly recommended. And when we talk about prophylaxis, they received antibiotics, they didn't receive a vaccine. So just to kind of clarify that question.
How is it transferred from one person to another?
A number of diseases are transmitted by droplets, and that's the reason we ask people to cover their cough, and because when you cough or sneeze, little tiny droplets go out from you. If they land on somebody else's mucous membranes, then the virus or the bacteria can be transmitted to you, and that's generally how it's transmitted. And many many diseases are transmitted from one person to the other.
Sounds like this one's way less contagious, though, than the flu or...
Right. It's way less contagious, and it's way more serious if you get it. Right. Okay. Any more questions? Thank you very much.